Well, hello everybody. How are you today? Happy Wednesday. Happy July 1st to you. Start of a wonderful new month, wonderful new quarter. So, as promised, I am coming to you live today to share my personal review of the medical literature around wearing masks. Okay, I know, big topic. A lot of people saw my video yesterday where I walked out of a floor decor and more store and was upset because I was kicked out for not wearing a mask in a store where there was no other people except myself and my husband and the manager. But we will put that aside for now because this is about medical facts. Okay, so why am I doing this? Well, I've actually been gathering research about COVID-19 since early February, okay? I have been studying this, and as this mask situation has been coming up more and more recently, I have been feeling led to start posting about it. The timing was not right. However, yesterday something sparked in me and the timing became right. Now, would I normally have chosen to do it in that way? No. Those of you that know me know I usually very carefully plan what I am going to say and when, and I do it in a calm fashion. Even though I am a very passionate person, I present facts, okay? Yesterday, that did not happen. There was a lot of emotion there, but you know what? Sometimes, as a good friend of mine who's not a Christian reminded me last week, she said, you know what, Darlene? Jesus flipped tables sometimes. And so I guess yesterday was a table flipping day so that more people could listen and be here today. So for that, I am grateful to God. And I'm grateful to all of you who are here today. And you are all welcome. No matter what your thought process is, you are welcome here to listen and learn as long as you want, okay? Now, when I got my MD, okay, at graduation, I took the Hippocratic Oath, all right, which says first, do no harm. And I hold that very, very seriously. Now, a lot of people have different ideas right now about what do no harm means. To me, here's what it means. It means not perpetuating a lie when I know there is a truth, okay? A lie is very insidious and it can actually do a whole lot more damage in a lot of cases than what a virus can do. Yes, I did just say that, okay? So I am here to shine light on the truth. Whether you choose to believe that truth or not, that is up to you. You are entitled to make your decision, okay? I am presenting a truth to you, and then you can choose what you want to do. You can choose to believe me, not believe me. You can choose to do what I do or choose what you want to do. Totally fine. Okay, what we're going to talk about today. Number one, we are going to talk about the function and purpose of different kinds of masks, the N95 mask, the surgical mask, and the cloth masks, okay? We are going to talk about the risks of mask wearing, all right? We are going to be talking about medical literature to support everything that I am saying today. And then lastly, we are going to talk about making choices, because here's what I would love is at the end of this, or as you take time to think about this, that you make a choice that's right for you, okay? Whatever that is, you make a choice and you are confident in your choice, okay? Because that is power when you make a choice and stick to it because you are educated. All right, now let's see here. There were some questions about my background, so let me clarify those. Now, I did a very long post earlier this morning giving all of my credentials, and there's some people that seem to think because I chose to stop practicing in a hospital at the end of 2017 and let my license go last year that I am now stripped of my MD, which is absolutely not true. You do not lose your medical doctorate when you choose to not practice in a hospital or in a clinical setting anymore. I am still a medical doctor. I am still I'm actually a neurosurgeon. Yes, I am board certified through the year 2023. So you can look up those credentials if you would like. I am not going to spend any more time doing that. I am not an immunologist. I am not an epidemiologist. I am, however, a researcher. I have been doing neuroscience-based research for, over 20 years now. I have run major clinical trials. I am still to this day called on to review grants for clinical trials that are considered. I am still to this day called on to review medical articles for their data integrity, all right? So do not question my ability to interpret the medical literature. That is what I am presenting to you today. I will not be giving you a suggestion on what to do with this information. I will be presenting information to you, and I will be sharing with you what decisions I have made and what my family has made. And then you choose for you. Any other questions on that? Review my last post. I'm not going to discuss that anymore. Okay, so purpose and function of masks. All right, so the N95 mask, right? That's the one that's very tightly fit to the face. It is worn by medical professionals. It's also worn by construction workers. That's what my husband does. He wears them too for his job. And the idea for that is to keep external particles away from you, okay? It has a little spot on the front for you to exhale through. That filter, if you will, blows out unfiltered air. That is how you expel unfiltered air. So for those of you who are walking around wearing N95 masks out in society, I am not talking about medical professionals. Let me clarify. For the average person who is walking around wearing an N95 mask, okay, you might be possibly protecting yourself. We'll talk about that in a minute, but you are certainly not protecting another soul on this planet by wearing that type of mask if you are infected with COVID, okay? That is just a simple fact, all right? Now, there are differences between bacteria and viruses, and a lot of people don't understand this, and this is where these surgical masks get confused by a lot of people. I practice as a surgeon for a number of years, and of course I wore surgical masks in the operating room, all right? The idea is to prevent droplet transmission from the surgeon to the patient or fluids coming back from the patient to the surgeon. That's also why we wear eye protection in the operating room, okay? It is designed, surgical masks are designed to prevent bacterial transmission, okay? They are not, the size of the filters is not appropriate to filter out viruses, okay? So can it slow down droplet transmission? Absolutely, which is why the WHO, the CDC said from the beginning, okay, if you are sick, if you are coughing, if you can't stay home, if you must go out and you are sick, wear a mask, okay? It can reduce that droplet transmission. But as far as being an asymptomatic carrier who is not producing a lot of droplets, all right, if you are following the other guidelines of social distancing, being 6 feet away or 3 feet away is what they want to do in Europe, right? If you are hand washing, okay, that mask does not prevent viral transmission, okay? So that is a medical fact, and I have studies that I can share with you on that. There is a study by Cowling in 2010 that studied both the N95 mask and the surgical mask, and this was done right after the 2009 H1N1 big outbreak, okay? And what they determined that if you were sick, it can reduce transmission of H1N1, all right? Otherwise, there was absolutely no benefit to mask wearing. There is a literature review, Ben Rizza in 2012, which showed also there was no protection in mask wearing from catching the flu. This is why we've had influenza around for a very long time, and there has not been a mass order to wear masks. All right. Smith et al. 2016 compared, this is very interesting, compared the N95 mask and the surgical mask to see if one was superior to the other over influenza transmission. Guess what? No difference between the masks, okay? I would love to give you some literature on cloth masks, but guess what? It doesn't exist, okay? Where this came from as far as cloth masks, I don't have any idea. I can surmise, but I don't have any evidence, so I'm not going to share something with you that is my conjecture, okay? So you can leave that to your own. There's no literature currently on cloth masks. That will change soon. I'm going to talk about some upcoming clinical trials that are ongoing studying this issue in a few minutes, all right? So there, to summarize this, okay, there is evidence that social distancing, okay, can be effective to reduce viral transmission. There is evidence, and this has been around for a long time, there's a plethora of research studies that hand washing, disinfecting your hands, disinfecting surfaces like your cell phone, okay, can reduce viral transmission. There is also evidence that if you are actively sick, that wearing a surgical mask can reduce the transmission of symptoms to someone else, okay? That is what we know. But N95 mask, if you are not a healthcare worker, and I am not talking about healthcare workers here, okay? That is an entirely different thing that we're not discussing today, okay? Because that is to a very specific audience. But that's what you need to know about this, okay? There is the next thing that I want to discuss is complications of wearing masks. Now, this one is really interesting because guess what? When I was operating as a neurosurgeon wearing a mask, okay, for my surgeries, I actually was not aware of this research. Why nobody shared this with me, I don't know. And I didn't think to look it up before then. But I've actually studied this because when I was in the operating room at one point and feeling short of breath after having had a mask on for a very long time, I had the anesthesiologist check my oxygen level with a pulse oximeter. They put it on your finger. I think he put it on my ear at the time because my hands were gloved. And guess what? My oxygen level was low. Yeah, absolutely. It was too low. When your oxygen level drops below, it's a saturation level, okay? It's a measure of how much oxygen is in your blood, essentially, is a simple way to think about it, okay? Ideally perfect is 100%, all right? Less than 92%, we start to get concerned as medical professionals. When it gets below 88%, then you actually qualify for supplemental oxygen, even if you're at home, right? You qualify for that. Why is that? Guess what? If you don't get oxygen to your brain, parts of your brain will die, okay? If you do not get oxygen to your heart, you can have a heart attack. Part of your heart tissue will die, okay? Oxygen, super, super important. And there are studies on this. So there is a study by, I think it's Lahme, L-A-H-M-E, in 2001. So this one, first of all, is on patients who are undergoing what's called regional anesthesia. So this is not where they go to sleep, but where you do what's kind of called a nerve block. So they would give you an injection maybe in part of your in your arm to numb the nerves so they can operate on your hand, for example, right? And they studied whether wearing surgical masks, whether the patients wearing surgical masks decrease the risk of bacterial infection, which is what I've talked to you about, right? Surgical masks are to decrease the risk of transmitting bacteria, okay? They did a study on this, and guess what? Showed not only did it not affect the infection rate, the bacterial transmission rate, but guess what? It lowered the oxygen level of the patients. It increased their carbon dioxide level, and it led to increased anxiety. All right? There was a later study, Better et al. In 2008. Okay, this actually studied surgeons wearing masks. And guess what? Their oxygen level dropped when the masks were worn for more than an hour. And it was more pronounced in individual surgeons who were over the age of 35. It is no wonder to me that that mortality of surgeons is so much younger than the rest of the world. I'm not saying it's all due to mask wearing. There's a lot of stress with surgery. One of the things I do now is I work with surgeons who are in burnout to help them overcome that so they can stay in their field and thrive and not live a burnt out life. So stress could have an effect, but I can't tell you what effect wearing a mask for all those hours has. And here's what I believe, and this is my opinion right now, okay? So let me be very clear about this. If this requirement by many governments and individual corporations continues for people to wear masks for a prolonged period of time over a long term, here's my prediction, and we can test this out and see what happens, okay? I predict that people are going to have more diseases come up, more respiratory diseases come up, okay? You may even see an increase in the flu. I don't even know. That there's a lot of conditions that are worsened by lack of oxygen. When you put increased stress on any system in your body, guess what? That actually weakens the other systems. So if you already have a chronic medical condition and then you add some other problem to it, like lowering your oxygen level, guess what? That actually can make not only that chronic condition worse, but it can actually start causing problems with other organ systems in your body. This is why critical patients in intensive care unit go into what is called multi-organ system failure. And guess what? It often starts in problems in the lungs. Okay. Now we are going to, I do want to mention a couple of things. This was which study is this? This is a study from, this is a study from May of 2020, okay? So this is about COVID. And let me qualify this by saying, because there's been a lot of studies coming out about COVID in the last 3 months. And I will tell you that usually there is very rigorous review of literature before it's published. It's actually hard to get things published very quickly. Traditionally, it has been, okay? When I do reviews, oftentimes, they give us 2 weeks as reviewers. Oftentimes it can take longer, and then it goes back to the authors. They have to rewrite the manuscript. It comes back to the reviewers again. It often takes months to get things published, okay? Very, very rigorous reviews. Because of the urgency of this situation, there has been a lot of literature published on COVID in the last few months that has gone through extremely quickly, okay? There's disclaimers about this even on the PubMed site, right? So it is hard to tell what has been rigorously designed, what has been, what is valid, what is not, okay? But it does say that, okay, even in infections traditionally considered to be spread by droplets, such as influenza, aerosol transmission may occur when healthcare workers are in close proximity to the exposure source, or when the droplet evaporates and becomes droplet nuclei. Okay, so they are actually studying whether COVID is transmitted by aerosol, okay? Which would mean that your mask that is preventing droplet transmission is not going to be helpful, okay? I will say that. They also studied that even though this is for healthcare workers actually. So N95 respirators that have greater protection than a surgical mask, the advantages of N95 respirators, hear me clearly, this is straight out of this article, over surgical masks in carefully controlled laboratory studies do not seem to translate to decreased infection risk in real world settings. Okay, that's straight out of a brand new journal. Okay, so here's the situation. You have some choices to make, right? Okay, your first choice, number one, do you think I'm still credentialed? Okay, do you think my 17 years of school and training and then 10 years of practice as a neurosurgeon has gone out the window and my brain, something has happened to it? If you do, then go, and I wish you well. Okay, that's fine. Go get your information from wherever you want. All right, so choice number one. Choice number two, if you do believe that I'm a credible source and I know how to read the medical literature and make an interpretation of it, then you choose for yourself what you want to do. But I ask you to just make a decision, okay? Make a decision, and until there's compelling reason to change your mind, stick with it, because that's the only way. When you design a research study, you can't be changing things up all the time. You make a decision, you stay with it until there is a compelling reason to change your protocol, okay? So make a choice. Here's what I've seen, all right? I have seen people wearing masks that have a false sense of security, have thrown social distancing out the window, okay? Case in point, the manager that spoke to me yesterday, I was by myself, okay? I was with my husband, but essentially by myself. Nobody was within, I don't even think there was anyone else in the store. The manager comes within 1 foot of my personal space to have a conversation with me because he's wearing a mask and he feels protected. I've seen this in other situations too, where people, they're wearing masks, they're forgetting about staying apart, which is one of the main ways, staying apart and washing your hands, disinfecting. Those are the main ways to decrease viral transmission, and that goes out the window. There's this false sense of security. These cloth masks that are being made, how often, if you're wearing them, how often are you washing them? Are you washing them? Are you disinfecting them every time you go out? Are you changing them every hour? Because if not, I haven't studied your cloth masks, but I would guess there's a lot of bacteria hanging out on those masks, okay? And you may say, I just said bacteria are one thing, viruses are another. Yeah, but guess what? You get a bacterial infection, guess what your immune system is doing? It's fighting that bacterial infection, okay? Then your white blood cells are not going to have enough reserve or as much reserve to fight off a virus, okay? So here's what we are doing in our family. Let me be very, very clear about this. I do not choose to wear a mask, okay? For the reasons that I have described for you today, all right? When school starts back in the fall, if my children are asked to wear a mask, I will be homeschooling them or finding another way to school them, okay? All right? That is what I'm doing. We are boosting our immune system. That is what we choose to do. We also are being very judicious about when we go out, okay? The Amazon guy knows me pretty well, right? We go through the drive-through whenever possible. We go through, I had to go to Walgreens today, and I drove through the pharmacy and asked the window to ask them to get me something, okay? But there are times that we need to go into a store, and we should not be made to feel less than because we have made a choice. Also, I do want to share with you, if you have a medical condition that makes it difficult for you to wear a mask, if your oxygen level drops precipitously, so significantly, it makes it dangerous, the American Disabilities Act will protect you, and you have the ability to do that. I encourage you, if you have a medical condition, not advising, but encouraging you, this is what I would do, is try to stay away from places with a lot of people, okay? Follow the guidelines, the WHO website. Read that, folks. There's nothing about face masks, okay? Read it. It says social distancing, hand washing. If you're sick, stay home, okay? And then I wanted to say to those individuals who are not my clients or customers, who are pretending to be my clients and customers on my business page and giving me negative reviews, Well, guess what? You have not purchased anything from me. You have not purchased my services or my products. And so you will be reported and your fake recommendations will be deleted. So keep your own business to yourself, okay? I have been very open. I have been very kind towards everybody. I have not deleted one comment despite the incredibly vicious remarks that have been made, because I believe in free speech. But I also believe that we are in a society where we can agree to disagree and still do so from a point of love. That is what I promote. I promote love and I promote the truth. And I will continue to do that. I will continue to share information. If you do not like what you hear, that's fine. You know what? You have an off button. You have a stop button on the video, on your phone, on your computer, whatever you're watching me on. Choose, choose, choose. Okay? That's all I have to say. Have an amazing, blessed day, everybody. Take care.